The president took his model for health care plans from Massachusetts. Massachusetts had only about an 8% uninsured rate at that time, with lots of ERISA plans covering their major corporations. Turns out, about 20% of Americans are uninsured. So if you take a model from a state that started off with only 10% uninsured and lowered it to 4%, I'm not sure that it's generalizable as, say, we in Louisiana, who start off with 30% uninsured. If we can find solutions for our issues, I actually think those will work better for the country at large. What are some of our issues? Well, if you think about health care, it is Medicare, which is health care for the folks over 65. It is Medicaid, which is the health care for those who are poor, and then it's a private insurance market. Now, if the goals of health care are to provide access to quality health care at an affordable cost, access, cost, quality, then within Medicaid, Medicare, and private insurance, we have to figure out how to lower costs to expand access to quality care. Now, this is not just a theoretical argument. You know, Medicare is going bankrupt in 7 to 10 years. The Medicare Trust Fund is going bankrupt. The program we've all paid into will have nothing in it in 7 to 10 years. And the president's health care plan actually took $500 billion and didn't take those savings to put it back and to shore up Medicare, but rather to use it to create another entitlement. Now, I'm a Republican, some of you are Democrats, Independents, some Republicans, we're First Americans. And I can say on a bipartisan basis, this has been recognized. The president's bipartisan commission said that our country's indebtedness is that which is going to bankrupt us. Admiral Mullins, who is the former chief of staff, said our greatest threat to our national security isn't China, Iran, or Al-Qaeda. It is our national debt. Now, the president's bipartisan commission said our national debt is being led by Medicare, Medicaid, and health entitlements. I'm a doctor. If I wasn't here this morning, I'd be at Earl K. Long Hospital, Baton Rouge's version of Chabert, seeing the uninsured. So getting this right is important not just for our country, but also for my patients. So I think we as Americans need to look at the president's health care proposal as how well it does that. And frankly, I don't think it does it well. The president's bipartisan commission on the debt said that health care costs were going to bankrupt us after the president's health care plan was passed. The president's health care plan arguably makes it worse. The Congressional Budget Office now says it's going to cost us about $2.7 trillion over 10 years. I'm remembering that, so I'm a little fuzzy on the numbers. But the point being that the health care plan that was passed actually makes it worse. But there are solutions. We're Americans. We can come up with solutions. For Medicare, there's now a plan out there that Ron Wyden, a liberal Democrat from Oregon, and Paul Ryan, a conservative Republican from Wisconsin, have come together on. But it's a plan that was first thought of by John Breaux when he was a senator, and he had this whiz kid named Bobby Jindal working for him. And Jindal and Breaux came up with something called premium support, where someone would decide what health care plan they wanted. They would choose from a menu, I want this one, I want that one, or this one. The federal government will send the dollar to that health care plan. If you're poor, the government pays for everything. If you're Warren Buffett, you finally get your wish and you get to pay more than everybody else. If you choose a really low-cost plan, you can put money back in your pocket. If you choose something with bells and whistles, you pay a little bit extra. But the idea is the patient is in control. The patient has the power. It's a great plan, and it saves Medicare. Under the Wyden-Ryan plan, nothing changes if you're already on Medicare or if you're 55 and above. But if you're like me and you're 54 or below, then you would change to this premium support plan. As an American, I think it's great. We're going to rescue Medicare from bankruptcy, reserving it for those who want it as it always has been. But frankly, also reserving it for someone like me who will be. Because right now, it won't be. Now, if someone has a better idea, I am open to a better idea. But the fact is, we can't just say do nothing We know in 7 to 10 years, Medicare will go bankrupt.